And welcome to the Davies Use Case webinar being presented by NOMS Healthcare on improving quality scores. This is a Davies Award winning use case for the value of health IT. Arnold Simmons, I'm the Manager of Quality and Patient Safety, and it's my pleasure to moderate this presentation. To the HIMSS mission is promoting the use of health IT to improve the quality of healthcare delivery. HIMSS advocates the integration of clinical decision support and best practice guidance, access to clinical data to analyze progress, and IT-enabled patient safety tools for all healthcare organizations and clinics and community members as vehicles for improving outcomes. HIMSS Nicholas E. Davies Award of Excellence is the pinnacle of the Value Recognition Program. The award recognizes outstanding achievement of organizations from around the world who have utilized health information technology to improve patient outcomes and value. The award's winning use cases have been peer-reviewed to validate sustainable, improved patient and business outcomes resulting from IT-enabled delivery. It's my pleasure to welcome our speakers for today's webinar, Missy Thomas, Dr. Jennifer Holman, and Rebecca Robach. I will turn the presentation over to them and let them go ahead and get started.
Good morning. I welcome you to NOMS Healthcare. My name is Ms. Smith. I'm an employee of NOMS Healthcare for 10 years. I began a career here at NOMS as a medical receptionist. 3 years joined the IT team as an analyst and was promoted to IT director in April of 2015. Most recently transferring roles to the IT project director in November of 2016. Joshua Frederick. In March 2007, Josh joined NOMS Healthcare as the Director of Finance. And as Finance Director, Josh has served NOMS as CFO and COO. In 2015, Josh was promoted to CEO. In his role, he effectively doubled the size of our organization in less than 20 months. We have Davies Holman. She's the Executive Vice President of NOMS Healthcare. Davies joined NOMS Healthcare in 2010. Davies Holman is a board-certified physician who specializes in family medicine and aesthetics. Along with the role of Executive Vice President, she is also our PCMH Clinician Lead, our Provider EHR Super User, as well as the co-chairman of the Standardization Implementation Committee. Robach, Vice President of Population Health. The majority of Becky's career has been spent in the nursing field, with over 15 years practicing as a nurse practitioner. In 2013, she joined NOMS Healthcare as Vice President of Population Health, overseeing our NOMS ACO, or also known as Accountable Care Organization. Becky works with the champion physicians of the organization to promote the transformation of healthcare delivery. She's the Director of Care Management. Holly was here at NOMS Healthcare 10 years ago as a nurse. In 2015, Holly was promoted to Director of Care Management. Holly had tremendous growth in the care team over the last 2 years. They began with 2 team members, herself and a social worker, and has grown to a 26-member team today, consisting of RNs, LPNs, social workers, medical assistants, and a dietitian. Stephanie is a clinical IT analyst and a valuable employee of NOMS for 3.5 years. Stephanie's at NOMS includes building and modifying reports, creating histories, interface mappings, and ensuring the quality data extracted from our EHR is validated. NOMS is a multi-specialty organization in Northern Ohio, serving 10 counties with 186 providers, 55 locations. NOMS delivers superb care to an average of 1,132 appointments a day. About NOMS Healthcare. In 2001, Northern Ohio Medical Specialist was formed with 32 physicians. In 2010, NOMS formed an Information Technology, or IT committee, to explore converting from paper charts to an electronic medical record platform. Later, NOMS' newly formed IT department began implementing an EHR system-wide. In 2012, NOMS received NCQA Level 3 PCMH recognition. In 2013, NOMS Healthcare was recognized as one of only 35 advanced pay ACOs across the nation. Our current team, NOMS 360, was instituted. In 2017, we were granted CPC Plus designation for all of our well-established patient practices. Currently 6 providers and 646 team members. Totals gathered from the electronic access that we have shows that in 2012, NOMS had 261 employees. Today, our team consists of 646 team members, and are continue to reflect our growth at this rate. In 2001, NOMS began with 32 providers. We have increased in providers with this jump in the last couple of years, more than doubling our provider count. Today, NOMS has 186 total providers practicing. Our focus today is on improving quality scores. The local we found was we needed to have the ability to effectively track our quality measure data via scorecards and registries to improve on quality scores. And team prior to our EHR upgrade, we mainly reported on 8 quality measures. By the 2016, after the EHR upgrade, we effectively electronically reported on 23 quality measures. Here are NOMS overall quality metric scorecard from 2013. Goals set based on payer benchmarks and HEDIS data. 2016 scorecard. As you can see, we have increased our number of metrics we now report on. And are given a scorecard quarterly to keep them informed of their performance. I'll give a brief overview of our steps we took to achieve improved quality scores. We have our current EHR to a new EHR system. We formed a standardization implementation committee that can standardize template. Decision support system, our CDSS alerts. We pre-visit planning using our standard templates and alerts to guide our staff. Messaging, flu, pneumonia vaccine reminders, and Medicare wellness campaigns. We created questionnaires specific to Medicare wellness. In 2014, NOMS Healthcare upgraded our EHR system to eClinicalWorks. This is in order for us to improve the quality of clinical services as well as create an effective process for the management and reporting of quality improvement. In August 2014, our Standardization Implementation Committee, also known as SIC, was formed. It was formed with provider representation from each specialty, along with the entire IT team. We also did the administration team. Standardization committee was to standardize and create NOMS best practices across our entire organization. In order that, we needed to create standardized templates. Standardized were created for each specialty and introduced to the team. We then a template request form to be used when any changes needed to be made to a current template or a new template or report was being requested. Here's our report request form. Here's our template request form. We have a spreadsheet requesting a new template, be created or a change to an existing template. We ask very specific questions, including where to place the needed information, so this data can then be successfully extracted in the future. We have a spreadsheet that offices complete and submit along with the template request form. The standardization committee for approval before they're created or modified by the IT analyst. For recent request we received was regarding transition of care and if they have been completed within 24 to 48 hours of hospital discharge. We add this to a structured field located in the transition of care template. This is the ability to pull data via a report created within ECW to track the number of patients that had a transition of care completed within the recommended time frame. This is just one of the many care delivery measurements for CPC+. We visit planning. Pre-planning is utilized by a vast majority of our offices prior to the patient's appointment. Our staff reviews the patient's outstanding preventative health care needs prior to the appointment. This physician and what needs to be addressed at the time of the appointment, in addition to their chief complaint of the scheduled visit. By visit planning, the provider has instant access to care gap closure by meeting the patient's urgent needs. Templates, we created alerts, diagnosis-specific alerts, the SS alert, template. Medicare Wellness template was introduced as a mechanism to capture many quality measures that need to be reported annually to CMS and other payers. Create template ensures all of our offices are documenting in the same place. Then guarantees an efficient and accurate data extraction. Template is one example of the many standardized templates we have instituted to aid data capturing. Our specific alert. Here's a specific alert that we created for diabetes. The alert will trigger on any patient whom has an active diagnosis of diabetes in their problem list and have not a retinal eye exam or microalbumin completed in the last 1 year. Templates and alerts aids in the immediate need of the patient at the point of service, all while saving the provider time. The clinic takes care of all the prep work, which places all the necessary needs of the patient at the provider's fingertips. This then face-to-face time between the provider and the patient. Examples of the CDSS, also known as the Clinical Decision Support System alerts, that are built within ECW. For us, all female patients aged 40 and older whom have had a mammogram completed within the last 24 months will receive an alert. If a female patient over 40 years of age has an active diagnosis in their problem list that includes history of bilateral mastectomy, this would then not trigger for that patient, as this would be considered an exclusion to the measure. Messenger. ECU Messenger is a great tool used to enhance patient engagement in conjunction with our patient portal. We messenger services for screening campaigns, Medicare visit reminders, well reminders, pneumonia vaccination reminders are also a few. Our specific messenger campaigns around the National Awareness Month. For example, the breast cancer campaign goes out yearly during the month of October. We send our well child ages 13 and older are sent prior to school starting as a reminder to get their school and sports physical completed. Over its period, NOMS has sent 84 lab notifications to the patient portal. 5,484 appointment reminders and have sent 300,884 general messages to our patients. Three categories of messages, we have sent a total of 740,396 messages. If we never call each patient with those messages, calls could take from 1 to 10 minutes or more. Each calls were only 3 minutes. That would equal 2,221,188 minutes, or 37,019 hours of our team's time. This is work to keep 9 team members busy for 2 years. This is another cost savings for our organization. Campaign, our reminder care patients of their annual visits. Some of this campaign was revenue, patients for improved wellness, Medicare patients for whom it has been over 1 year, which is a reference to service date on the claim, since they have billed a G0438 or a G0439. And we can send a message via portal, email, text notification, or voice notification. Here's all of what our kiosk looks like. Questions only require a yes/no answer, as you can see from the question pulled from the NOMS Family Practice Internal Medicine Medicare Wellness Questionnaire. Can you shop for groceries or clothes without help? Select yes or no. And see, there are many questions associated with the Medicare Wellness Questionnaire. A time savings created by having the patient complete in the waiting room prior to the patient being seen versus the medical assistant reviewing each question one by one with the patient. Keeping in mind that most often the patient's answers would be more than just a yes/no answer.
To help improve patient quality care, we developed the Patient Care Quality Committee, otherwise known as PCQC. We established this in 2013 to help transform our practice. We meet weekly and discuss patient care issues. We can disseminate quality scorecards, validate the data that's on the scorecards. We establish the thresholds of the scorecards based on AO information, the quality improvement projects using the PDSA model, and we ensure best practices are communicated and deployed across the organization through monthly managers meetings. PC identified many areas in need of improvement. We've the initiative to increase our quality scores for diabetic eye exams. PC approved the purchase of a retina view to be used across the entire organization. You know, we're in 7 counties, so we developed a schedule and patients that were in need of the eye exam to come in and get this service performed in hopes of increasing our diabetic eye exam quality metric score. So you can see in Q2 2016, we 23.8% of patient population that was compliant with this measure. In 2017, we increased this by double.
So, standardization conforms, we set workflows, create enhanced data extraction, we deploy and provider EMR training specifications. And in November of 2014, eClinical Works went live. Of 2014, we were utilizing an EMR system vendor. EHR, kiosk, and messenger campaigns. Training. All team members, including physicians, attend 1.5 days of EMR training. We have new offices. They attend 1.5 days of EMR training, and also required during the first week of go live that offices cut back patient volume to 50%. During week of go live, if offices are doing well, we can increase volume, only to be cut back to 25% of their volume. During the third week, if they're doing well, we resume normal patient volume. How utilized. HIMSS has significantly improved our efficiency in delivering healthcare to our patients. The big movement was the upgrade to our EHR, and then all the time-saving add-ons we have implemented since the upgrade. Course creation, we created alerts, we developed kiosk questionnaires, we workflows, we provide provider training, we have created reports and registries, all within ECW. From this initiative resulted in improved metrics along with improved outcomes. Here's our quality scores that show our vast improvement over the last few years. Our medical care wellness scores in 2013 were 30%. Today, increased that to 65%. Flu, same 2013, we were at 32%. We've increased that to 50%. 2013, 33%. Today, 83%. Smoke in 2013, we were 50%, and today we're 87%. Final slide, Becky's going to discuss our improvement with our bacterial pneumonia hospitalization rate.
So it showed how we improved our pneumonia vaccination rates from 33% in 2013 to our current metrics at 83%. This slide reinforces that by improving our quality metrics, we are having a significant impact on health outcomes. They're taken from the cost and utilization that NOMS receives from CMS quarterly. We take this information and we trend it to see that our utilization rates are having a positive impact. This provides that visualization as to the decrease of the hospitalization for bacterial pneumonia from 2013 to present. Note the blue line, which was originally above all MSSP, ACOs, and service world, and we are now below both of those. Uh, 16 NOMS healthcare bacterial pneumonia hospital rates. Again, this shows our huge improvement, recognizing that our quality metric of the pneumonia vaccine is actually having positive health outcomes. Sir?
We're Rebecca and Missy for that great presentation. I want to remind folks to other these use case webinars and recordings and other information and how to apply for Davies Awards. The information can be found posted at the HIMSS Davies Award website at hims.org/Davies. And thank you again for the great presentation. This one. So